I'd like to introduce, and if you're not who this is, I apologize, Katie Harvey and Ivy Bloom with the department, and they are going to talk to us for the next half hour or so.
Yeah.
I'll let you tell them what you're going to talk about.
Okay. Hi, everyone. Like Tara said, Katie Harvey and Ivy Bloom, we are with the Department of Health and Human Services. I am the Placement and Licensing Foster Care Administrator for the state of Nebraska. So I've got all of the placement and licensing teams across the state.
I am a program specialist at the department. I'm at a central office in Lincoln. I am over the foster care program, trafficking prevention, missing youth, and I'm also the disaster plan coordinator for the division. We wanted to visit a little bit and talk about tiered foster care and the Nebraska Caregiver Responsibility tool. These both were created right around 2014 with the Children's Commission. It was recognized that the department really needed to have some tools to be able to look to see how foster parents are caring for children and how we can reimburse them for that care. So we came up with the NCR tool, and along with that goes our tiered foster care. So tiered foster care is an extension of the levels of care as outlined in the Nebraska Caregiver Responsibility tool. This determines the level of care a foster parent provides a child or youth. DHHS collaborated with agency providers in FAPA, which is the Nebraska Foster and Adoptive Parent Association, probation, the Children's Commission, and other stakeholders to ensure the levels of care within tiered foster care will address and meet the individualized needs of each child in care to ensure their safety and well-being. So we started with 3 levels in our foster care tier system, and that was the essential level of care, enhanced level of care, and intensive level of care. And in each of these levels, we look at what foster parents need to do for training purposes, medical, family relationships, and cultural identity, supervision, structure, behavioral and emotional needs, educational cognitive development, socialization age and appropriate expectations, support, nurturance, and well-being, specialized skills, and tradition to permanency and or living independently. So to these first 3 levels, we added 2 more levels, which are the intensive plus and the specialized level of care. So when we added the 4th and 5th level of care, we were able to release a request for quotes, an RFQ, to provide the services of the 4th and 5th tier. So we have agency-supported foster care providers that help us to place children. So the agency-supported foster care providers who did not apply for the RFQ, they will only provide the 1st, 2nd, and 3rd tiers. When we released, CFS released the request for quotes for agency-supported foster care providers to apply for that 4th and 5th levels of tiers. The agencies who responded to the RFQ across the state are Apex, Better Living, Child Saving Institute, KVC, Lutheran Family Services, Omni, Release, Inc., and Cedars. Out of these agency-supported foster care providers, they identify to DHHS their homes that are able to provide the 4th and 5th levels of care. Those 4th and 5th levels also have advanced training that the foster parents need to do. And then we really look to make sure that we're addressing the needs of especially our medically fragile youth, and then any type of youth that have, that really extreme trauma situations, such as trafficking situations, our youth that go missing from care. So we're really looking for those families to really have that good relationship, build relationship with these children that are in their care. Also, reach out to biological parents, because we know that when foster parents and biological parents work together, that is creates much more better well-being for children in care.
Okay, so, and at any time, I just want to throw out there, if anybody has questions, please feel free to interrupt us and ask. The NCR, the tiered foster care, cannot exist without the utilization of the Nebraska Caregiver Responsibility tool. So what's up here is just a snippet of our policy in regards to the use of that NCR tool. So any foster care placement, any state ward who is placed in what is considered a foster care home has to have an NCR completed. In order to do that, the CFS specialist utilizes the Family Strengths and Needs Assessment, which is part of the SDM tool that we use to determine what the needs of the child are. And then we utilize that to inform the completion of the Nebraska Caregiver Responsibility tool. What's a little bit unique about the NCR is that it's what the caregiver will do. So it's not, the FSNA informs what those selections are, but it's really what is that caregiver willing and able to do to support those identified needs and strengths that youth has to help move them towards increased safety, permanency, and well-being. Again, so the NCR goes over, these are the 8 levels, which really do align with, this is how we developed the requirements for that tiered foster care of level 4 and level 5. Regardless of what level a youth's placement ends up being, this NCR has to be completed. I wanted to make sure I took a little bit of time to note that it's important. We've had a lot of confusion since tiered foster care has come out with regards to kind of what does this look like? Where are these tiered providers at? I'm not, maybe I'm not seeing, I've got this youth that I think is really going to be at a level 5, and this home doesn't exist. And so the reality is that the additional levels of tiered were created, but there weren't necessarily new homes created from this service. It's still the same pool of foster homes that existed prior to the implementation of tiered care. The agencies have to identify, like Ivy said, which homes are prepared and able to provide that level of care. And then it's the same process of any other foster placement where that agency, that home, and the case team have to agree that that placement is a good fit for that youth and that they will be successful in that placement. Also important to note that tiered homes can be traditional foster homes. So what some refer to as when a child is placed with a home they did not have a relationship previously, or relative and kinship homes. So if we have a relative or kinship home who really has some unique skills and ability to provide that higher tier 4 or tier 5 care, we can work with the agencies that are identified to provide tiered level of care to get them trained and get them to be qualified to be at a tiered level, and then update that NCR as appropriate so that reimbursement is reflective of the additional care that they are providing. A lot of times I think we can all agree that kids do best when they are with people that they know, similar to how Ivy talked about the importance of that relationship between foster homes and biological parents. When we can support those relative and kinship homes to really be successful in providing that wraparound services in essence, we tend to have, we like to see that we have some better outcomes. Let's see. Okay. So with the NCR, just so that this group is aware, different times that the NCR is completed are listed up here. There's actually 2 pages of this, but with the initial placement into the foster home, the department has 30 days to complete that initial NCR when it is a new removal. Any change of placements require an updated NCR at the time of placement, as long as we are beyond that initial 30 days of the youth coming into care. And then we also do an updated NCR at the request of a foster parent, at a request of the agency supporting the foster parent. DHHS can recommend that it be updated. When anybody on the team identifies that there's some needs, some child's needs have changed, or there's additional responsibility going into the care that the foster home is providing, permanency plan changes, and then also when a youth is in an APLA placement with an independent living setting 30 days prior to youth turning 19, that NCR has to be updated. So that is really, truly, oh, we got one more slide. Sorry, guys, I'm clearly super prepared. Where we go, happy Friday. Okay, so, and this is kind of similar information to what I really just talked about, that when they're initially removed, we place. I think one piece that's important for any stakeholder with the youth that is currently in care to understand is that it is best practice, and the expectation is that these NCRs are completed with the foster family, ideally with the agency that is supporting that placement present. And if the youth is of an appropriate age, the youth should also be included in the completion of that NCR. We really want youth, and I think as you guys all know, for a lot of youth, these tiered placements are about our older youth, those youth that once they hit 12, they're more difficult to locate placement for. And so we're really getting to that point where we should be having conversations with them about what expectations are, what care looks like, what they need from a caregiver, and then also what they can do to help that situation be successful. And so I would encourage all of you as stakeholders to child welfare cases to advocate for these pieces to occur, that everybody is present, that it's a discussion that is happening at family team meetings and different places like that, so that everybody is aware of where things are at and we can help kids be the most successful. And then the CFS specialist has to finalize the place or the NCR for that to be official. And then there's that. Let's see. Oh, and InFocus calculates. The other piece that's kind of important to know, if a worker is doing, we have a paper version of the NCR. We have the ability to do it on our system of record, which is InFocus, or we also have an internet application that caseworkers can use to complete this. If a caseworker is doing the NCR on paper, they are not going to be able to tell you in that moment what the score is, because the scoring system is built in either to the app or to our InFocus system of record. And so it does kind of get calculated behind the scenes. They can have a good guess, but until that's finalized, which really shouldn't take too terribly long, a couple of days at most, they won't be able to say officially this is where this placement scored at. So this is just an example of the app that CFS specialists are able to use. Yes?
Regarding section 4, you don't have to go back. What's the base rate? Lowest level of care, one kid, what's the base rate?
20 something.
Without pulling it up, yeah. So
I just wanted to know where the floor was.
Yeah, so the floor is, no, I don't know off the top of my head because I have it saved into my browser. I apologize. Is it 23 now? They update July 1, so there's...
441.
Yeah, I was going to say, they just update it.
$441.
No.
24.41 per day.
Per day.
$21.41 per day.
24.
$24.41 a day.
But it's by age.
Right, and so where it's not an easy number to just pull off the top of your head, it also depends on the age of the child.
Yeah.
So 0 to 5, 6 to 11. Okay.
No wonder you're having trouble getting foster care.
So, let's see, next slide. Okay, this is another piece just so that you're aware as you're working with foster parents, particularly when a placement is scored at a level 1, there's not additional documentation supporting evidence that's required to show, because that is essentially the bare minimum of what the foster parent is expected to do. So every placement, regardless, will score at a minimum of a level 1. Once you hit level 2 and beyond, the foster parent, the agency, and the caseworker are required to provide, in essence, proof that these things are happening. So, for example, if you are providing specific behavioral interventions at the home that are driven and developed by the child's therapist, there's going to be an expectation that that is documented, whether it be in the monthly reports from the foster care agency where they're saying, hey, here's the number of times they went through and utilized this plan and kind of what the results are, if it's additional education support at home, additional levels of supervision, medically fragile youth, there's going to be documentation of the additional appointments and care that had to be provided. And so that has to be provided to the department. Otherwise, that will result in an audit finding for HHS in regards to not following our payment tool and ensuring that that what we are essentially reimbursing the foster parents for is occurring. Anything I missed on that, Ivy?
We just also talk about how the CFS specialists also document any foster children's needs, also in their case plan, their court report, their individualized treatment plan, and their placement support plan. So there's a lot of different tools that our CFS specialists can use to determine, hey, these are all the medical needs. So then it makes it easier for them to be able to document that information in the NCR to make sure we're not forgetting anything or missing anything to make sure that the foster parents are getting that correct rate for the child.
Another piece with the NCR that we really dove into with the implementation of tiered foster care is there are additional expectations of those foster care agencies and the support that they are providing for the foster parents. So as you go up in level, the expectations of what that support looks like from the foster care agency also increases, just in regards to the frequency of contact that they have with them, the development of their support plan and how robust that looks, and what type of trainings are not just offered to them, but ensure that they are completed. And then this is just an example of the front page of what a paper NCR looks like. And that is what a caseworker would use in a situation where they don't have access to the app out in the field to do that with the foster parents.
We've worked really hard with our web apps team to be able to get that technology out to our workers in the field, because we do recognize that, it's a lot easier to sit down in that moment and do it in the web app, or if you have your laptop, do it in Focus so that rate is determined right away. So they're able to let the foster parents know this is the rate, and this is, the things that you have agreed to support that child. So we have worked really hard, but we still do, have to, because of the ruralness of Nebraska, making sure that our workers do have alternative ways to complete the paper by paper form when they do have challenges with the internet. Are there any other questions?
Okay, thank you.
like to introduce April Coakley. She is a CFS CQI program specialist with Children and Family Services with the Department of Health and Human Services. So welcome.
Thank you. As Tara said, my name's April Coakley. I am a program specialist with the Department of Health and Human Services working in continuous quality improvement. I've worked in continuous quality improvement with the state for a little over 5 years, or right at 5 years. I have a total of 10 plus years in child welfare. What I do now involves a lot of data analysis, case reviews, targeted reviews, training, program improvement activities, and then just state and federal level reporting. But what I'm going to talk to you about today is the Children and Family Services Review, or the CFSR. Just out of curiosity, how many of you in here have heard of the CFSR? All right. Oh, just a couple, it looks like. So what we're going to talk about today is we're going to look at what the CFSR is. I'm going to also just give you a brief history of the CFSR here in Nebraska. I'm going to talk about the process of the CFSR and then what we're doing to prepare for our next round of the CFSR. And then I'm going to just talk to you a little bit about how you can each get involved in that CFSR process over the next few years. Okay. Maybe. There we go. So the CFSR is federal case reviews that are done in partnership between the state and the Federal Children's Bureau. And what we're doing is we're looking at cases to help ensure that we are conforming to the federal requirements within child welfare. We do review alternative response in-home and out-of-home or foster care cases. And these reviews help us to identify strengths and areas needing improvement, as well as they just help us to determine what's really going on with children and families as they're working with us and through our services. The case reviews are done with a review of information from InFocus, so our case documentation, and then it also includes interviews with case participants so that we can get a good, clear picture of what's really going on within the case. So the CFSR reviews are organized with 3 primary domains, so that's safety, permanency, and well-being. And then underneath those 3 domains, there are 7 different outcomes and 18 specific items that we look at in relation to each case. And each of these items receives a rating of either a strength or an area needing improvement. In some cases, it won't be applicable to that case. It could also receive a not applicable rating. But those are the only 3 options as far as ratings go. For foster care or out-of-home cases, what we're looking at, we are going to look at all 18 items. Okay. Alternative response and in-home cases, we're only going to be looking at the safety and the well-being domains. Those permanency items don't apply to those in-home and alternative response cases. So within safety, the review is looking at things like, we're looking at first and foremost, are those kids being protected from abuse and neglect? So we're looking at our response times for investigations. Are we meeting the required response times and getting out and completing those investigations timely? We're also looking at our risk and safety assessment to make sure that our assessments are adequate and that we're responding appropriately to any safety concerns that are brought up within that period of time that we're reviewing. Okay. And then we also look at whether we're maintaining kids in their home whenever possible. Okay. Within the permanency domain, we're going to be looking at stability in foster care and then timely establishment of permanency goals, as well as if we're achieving permanency timely. And then we're looking at overall, like I said, foster care stability, and then whether we're maintaining connections that those children had before they entered care. Within the well-being domain, we're looking at things like family involvement in case planning. We're looking at our monthly required face-to-face contacts to ensure those are occurring and that they're of good quality. And then we're also looking at the assessments of needs that are happening throughout the period under review, just to make sure that we are assessing adequately for needs and that if needs are identified, we are providing services to meet those needs. Okay. in addition to the case reviews, the CFSR also looks at 7 what they call systemic factors. And systemic factors are things and processes within the child welfare system that, if they're running well, should support positive outcomes as far as safety, permanency, and well-being go. Those specific 7 factors would be our statewide information system, which would be where we document everything. So NFocus, for those of you that know what that is. We look at our case review system, which includes our CFSR process, as well as some of the other case reviews that we do as a CQI department. We look at our quality assurance system as a whole. So that includes all of the case reviews, the targeted reviews that we complete within our CQI unit. We look at staff and provider training, and that's ongoing and initial training for our staff. We look at the service array and resource development, agency responsiveness to the community. And then we also look at foster and adoptive parent licensing, recruitment, and retention. And the information used to assess and provide ratings for those systemic factors comes from a variety of sources. It could be in what we call the statewide assessment that we'll talk about here in just a little bit. It could be just in federally reported data that we're submitting on a regular basis, or it could come from stakeholder interviews that happened during that CFSR period. Okay. And then the final piece of the CFSR is our CFSR federal indicators. Now, the federal indicators don't receive specific scores. They aren't rated a strength or an area needing improvement like most of the other areas in the systemic factors. But they are used to kind of guide the CFSR process. As we get into that, you'll see that in portions like choosing our sample, information from these federal indicators is used to help us get indicators. Our maltreatment in foster care, the recurrence of maltreatment, and then within the permanency outcomes, we look at permanency in 12 months, and we look at that broken down by length of time the youth has been in care. And then we look at reentry into foster care within 12 months, and we look at placement stability. So Nebraska has participated in 3 rounds of the federal CFSRs. 2002 was round 1, 2008 round 2, and then our most recent completed round was in June of 2017. During that time, we looked at all case information from April 1st, 2016 through the date of the review. So we were looking at a period of approximately 14 months for each of these 65 cases that was reviewed. Okay. We did have to complete a program improvement plan, or a PIP, after the review, which there wasn't a state that didn't have to complete a program improvement plan. And we were...
I'm sorry.
Go ahead.
How did you decide, or who decided what counties?
That's a good question, actually. Douglas County will always be chosen because one of the requirements is that you have your largest population center of the state as one of your locations. So Douglas County is going to be on that list every single time. The other 2 or 2 to 3 locations, it's really kind of up for negotiation. It's based on a lot of things. It could be based on some of that federal indicators data. If they're seeing some trends in that data in one area and they want to look more closely at those cases, then that might be where we end up. It could be that we're looking at other demographics and we're trying to make sure that our sample is representative of the demographics of the state as a whole. So we may choose a county that's going to help us get there. It could be that we're piloting some special project in some county and they decided they want to take a closer look at that project and how it's affecting our cases. So just in the months leading up to the review, there's a lot of negotiation back and forth between our CFSR, our CQI leadership, state leadership, and the Federal Children's Bureau to determine those locations.
So who has the final say? Do you or the feds?
Well, I think probably initially, if we can't get the Federal Children's Bureau to agree to it, then we're not going to have it. So I would say probably, to answer your question, they end up with the final say.
And how many of these case reviews do you do, and how do you decide what cases you're going to look at?
So it's a random sample of 65 cases for the federal review. I'll also get into some of the stuff we're doing.
Sorry, 65
Per county?
per each
No,
county? Or
65 cases total. So that tells you why maybe there's high standards as far as the ratings go, but it doesn't take very many cases being rated as an area needing improvement for that percentage to drop well below, and to pass an item, those individual 18 items, you have to achieve 90% or more of your cases have to have a strength rating. So we're talking 7 cases, and we are below that 90%. So
when will you have another round? When's round 4?
Round 4 is coming up in 2025. So we'll talk about, we'll go through that process in depth. We're working on preparing for it now, but that's kind of where we're at. So as far as the locations, it's really a negotiation to just determine where they end up. It could end up just about anywhere in the state, depending on what's going on at that time. So as I mentioned, we are moving into round 4 now. We are scheduled for our round 4 review in 2025. We don't know exactly when in 25, just we will be in the group that's done in 2025. But that process really begins now. We've already started gathering our data, preparing with case reviews on our own. We complete CFSRs, and really starting to get all that information and engaging stakeholders so that we can complete what's called our CFSR statewide assessment. So before the review ever happens here in the state, before they look at any of those cases, choose a sample, we have to submit that statewide assessment to the Federal Children's Bureau. Okay? And that statewide assessment will contain data from the federal reports that we have to submit regularly. It'll also contain data from different targeted reviews and case reviews that we do as a CQI unit on a regular basis here within the state. It'll include information from the courts and from the judicial branch. It'll include just a huge variety of information. We turn that in. It's usually due about 6 months before our review. And then that information is used to kind of guide the process, to help us with things like choosing our locations, choosing where our sample is going to come from, and making those kinds of decisions as we go through the whole process. So that's turned in about 6 months prior to the review. So we'll probably be working on it through most of 2024, or it'll have to be turned in at some point in 2024. Okay. Then we move into the on-site review. So the on-site review can happen in a couple of different ways. In the past, Nebraska has always done what's called the traditional pathway. And what that means is the Children's Bureau comes here to our state for one intensive week where all 65 of those case reviews are completed. All of the oversight is completed. All of the interviews, all of the stakeholder interviews for those systemic factors, and everything is done in that one intensive week. We have teams at various sites throughout the state just working together to get it done. Okay. There is also the option of what's called a state-led review. And in that case, we would lead the review here within our state. We would have a 6-month period of time, usually from April 1st to September 30th of that year, to complete our case reviews of all 65 cases. The Children's Bureau would still provide oversight, but their oversight they wouldn't be right there beside us as we're going through the reviews. Instead, we would be completing the review process, submitting them to the reviews to them, and then they would look through it, provide feedback, and we would get information we needed and would work with them to get them finalized so that we all agree with the ratings on each of these CFSRs. For round 4, we're not sure which route we're going to go, whether we're going to do the state-led or the traditional pathway. The state-led is an option that they're looking into, but as of right now, they haven't made that final decision. So I think we've still got a couple months before we have to tell them which way we're going. So
Have we done state-led before?
we have not, but I think my understanding is the Children's Bureau is pushing that more now with states. I don't know if that's a post-COVID effect. They don't want to be bringing huge teams together or what it is, or why it's different this time. But so we're looking into it, looking at our options. We've talked to some other states that have done it, so we kind of have an idea, their thoughts anyway, their experience going through it. But just haven't quite made that decision whether we'll do the traditional or there are definitely advantages and disadvantages to both. So, okay. All right. So then once that on-site review is completed, we move into, we receive a final report. And then from that final report, we start to create what we call our program improvement plan, or our PIP. Okay. And that's developed, and once it's approved by the Children's Bureau, we usually have a period of two years, I think is what the last one was, maybe 2 to 3 years, where we have to meet the goals within that program improvement plan. If we don't meet the goals within that program improvement plan within the time allotted, we do have financial penalties. So, okay.
We met our goals.
In the past, we have. There have been a couple that have been down to the wire, but we have in all of them so far. So, okay. So that's the whole process of the actual CFSR federal statewide review. As you can see, it takes, if we count the time now where we're preparing, it takes more than 5 years to make it through one round. So, okay.
That's including implementing the PIP, right?
Yes, that's including implementing that PIP.
What's an example of something that showed up on one of these reports that you had to do a plan on and how did you fix it?
Okay, so one of them that we struggled a little bit with this last time would be placement stability. Within the CFSR, you are essentially allowed one placement for that entire period under review. So for 14 months. And we have some high need kids that it's hard to find and maintain placements. And that's a struggle everywhere. I think that's probably why it's on there. But so then what we had to do is we didn't have to reach that 90% threshold that would make it a strength, but we have to increase essentially our percentage by a certain amount. I don't remember the exact number on that one because it's been a couple years since I've looked at it.
No, you don't have to get
right
to the 90%. You just have to show improvement.
Yes, you have to show a certain okay. percentage. There is a very specific number in that program improvement plan for each of the items that we.
Okay.
So then we, as a state, started working on targeted reviews related to placement stability, so that we were looking to see, okay, what's really causing the issue, and then from there we started looking at adjusting policies, procedures, processes, so that we could improve those numbers. So
does every state go through this?
Yes. Yep, every state goes through. Actually, the first round 4 ones are being done this year in other states. Yeah. Okay.
But I think you said most states wind up with a PIP, yes?
Every state winds up with a PIP. Every state.
Okay, so we're never going to achieve 100%.
Not on every not on every item. They're tough, and they should be.
Well, no,
they should be, but
it's like sometimes in classes you've had teachers that no one is ever going to get 100% in my class.
Yes, kind of, yeah.
That doesn't mean you stop trying. It just
right. So, yeah. So then there are a few differences heading into round 4 from round 3. Not major differences as far as the domains, the outcomes, and the items. Those are all remaining the same in the case reviews. There are some slight differences to some definitions. They cleared up some things that maybe were confusing for reviewers or weren't being consistently rated. Some little things like that won't really affect anything beyond the reviewers. But there are just a few differences. There is overall just an increased emphasis on advancing equity and inclusion throughout the entire process. The Children's Bureau has provided a guide that just gives detailed instructions on when and how they need to make sure that equity and inclusion is increased throughout all phases this time around. There also are some changes in the statewide assessment, and there's an emphasis on even more rigorous data collection and data analysis to support our assessment and our performance. Okay. And then there's an increased emphasis on stakeholder involvement throughout the entire process. We've always completed those stakeholder interviews, and they've been involved at various levels at different points, but there's increased emphasis on that throughout there. Okay. And then there is also a change in how they are measuring whether or not you pass your program improvement plan. Okay. So in the previous 3 rounds, all we had to do during that program improvement period of, like I said, 2 to 3 years, is we just had to meet or surpass our goal for that item one time. This time we have to show sustained improvement, which means we have to pass or meet or exceed that goal in 3 consecutive quarters in order to pass that item on the program improvement plan. So we've raised the stakes there too. So
How many people do these reviews in your office, and how many?
statewide, we have right around 20 initial reviewers, and then there are about 8 to 10 of us that do what's called initial QA or second level. So the review will be completed by one of our what's called a program accuracy specialist. They will then submit it to their initial QA, who reads through everything, make sure that they agree with all of the different ratings, make sure that we're not missing any data, make sure that we're supporting whatever it is our rating is very well, and make sure that there's no applicability issues, throughout the review. Okay. Then after that initial QA and the program accuracy specialists have worked together to finish that, sometimes it will go to another second level. So the initial QAs can do initial QA or second level. Essentially, they are being a third set of eyes on that, reading through it and making sure they agree with everything. And then during the actual CFSR on-site review or during our program improvement plan, the cases can also go on for what's called secondary oversight, which means that in addition to the 3 people who've already seen them here within Nebraska, we can have somebody from the Federal Children's Bureau also go through, read them, send feedback, ask for clarity. So it's not completed by one person. It goes through multiple steps before, and multiple people have eyes on those cases before we finalize the review and the ratings. So it can be a kind of lengthy process, but
In defining a lengthy process, on average, what does that look like?
well, it's definitely not the 1 week that they do when we do the intensive CFSR review, I can tell you that. Part of the process is that we do stakeholder interviews. And so what that means is that as part of this review, I'm not only reading everything in focus, and remember, we're looking at 12 to 14 months worth of data and documentation. That's every document that's been scanned, every court hearing, every bit of documentation they're looking through there. So they have to read all of that. And then they also have to set up interviews. There are certain interviews that we absolutely have to have. We have to have either the parents, each of the parents, and legal parents. Could be that we've also got 2 step parents and 2 bio parents. And so there could be up to 4 or interviews at that point for them that they have to complete. We have to either complete interviews with the parents, the children, if it's age appropriate and developmentally appropriate. For the most part, if they're school age and above and don't have any developmental concerns, we're probably going to be reaching out to them and interviewing them. Now, if we do talk to the case manager and they say, yes, developmentally it's probably appropriate, but I don't know that this would benefit them just because of their trauma history, and then we can also waive that there. We don't want to do anything to cause further damage or further harm or further trauma for the kids. But if we can, then we will interview the children. If we will interview every case manager that was on the case within that period under review, if we can. If not, we try to interview supervisors. people that have knowledge of what was going on within the case. And then we also, if we can't get all of those interviews, or if we have things that are conflicting, we may jump to others, pull in other stakeholders, other people who were involved in the case. Could be, we interview all foster parents, but it could also be service providers. There was a family support worker that was in there for a long time that worked closely with the family. We might interview them. We may also interview legal parties. So guardian ad litem, mother or father's attorney. And sometimes we will do those interviews in place of the parent interview if we have a parent who doesn't want to participate. So that process, we have a month to do them and to get through all levels. Most of the time we can do that. Sometimes they carry out a little bit longer than that when we do them on a regular basis. But
it's really a team effort, like on the federal one.
Yes.
Workers contact because it's typically sometimes it's cases that are closed. Mm-hmm. So then they call and say, hey, Casey Smith, will you please answer this call? When they call you, they're doing a review of your case.
Right.
So there's lots of hands.
But those interviews really help us to get a clearer picture. We can only see so much through documentation. By talking to all of those different people, we get to see all of those different perspectives. So that helps us to really see what's going on with these families. But right now, like I said, we're preparing for the CFSR round 4. To do that, the QA team is completing quarterly reviews right now. They do 65 cases a quarter statewide. Randomized sample could come from any office within the state. We're completing one round right now. We will do August and September, and then again in October and November. That'll round out this year. And then next year we will also do quarterly reviews to keep us going right up until we have the on-site review, the federal review in 2025.
One of the cool things about these when they do them is that we get the feedback. So then we can kind of put our heads together and kind of meet group on what we need to focus on. Gives us kind of an area to wrap our arms around.
Yeah, there is an individual report that's usually anywhere from 15 pages on, depending on the case. And that is sent to the case managers, to their supervisors, to the administrators. And then all of the data is also compiled and shared. And we can share that at the caseworker level. We can also aggregate that data, by service area, by office, by supervisor, by administrator, however we need to.
So if there were attorneys involved in those cases, do the attorneys ever see the feedback from these reviews?
I don't believe they actually get copies of the reviews. I don't know that I've ever had one request one, actually. To be honest with you,
if they wanted it.
To be honest with you, that is something I would have to check on. I don't know why we wouldn't if they were directly involved with the case, but since I've never had that come up, nobody's ever asked. I'm not going to say yes, for sure we can until I do some checking.
I'm just not sure how many attorneys were aware of this.
Yeah.
I hadn't heard about this till we were starting to plan.
Yeah. Okay. So just to kind of wrap up, there are lots of different ways for stakeholders, people that are involved in the child welfare cases, people that have an interest in child welfare, to get involved throughout the whole entire process. Our legal and judicial partners, there are options for you throughout every phase of this program as we're preparing that statewide assessment. I'm just giving your input, providing data. During that on-site review time, if we do the intensive, it's a little easier. You can participate in some of those reviews. You can also participate in the stakeholder interviews and just provide your experiences. During that program improvement plan, again, we'll be looking at you guys to help us with data, looking at that information, and to share your experiences so that we can develop the best program improvement plan for us throughout that. Same thing with our community service providers. I know we have a mix of people here in the room, and you also have those similar options. You can get involved during that statewide assessment time, during the on-site review, during the program improvement plan. One of the biggest ways is those stakeholder interviews and just sharing your experiences with us. Okay. And again, foster and adoptive parents, any agencies that do foster and adoptive parenting that support those homes. Again, you'll have those options within those individual reviews, providing information, providing your experiences on specific cases, providing your experiences overall to help us kind of guide where we go in each step of this. Okay. And really, Casey kind of said it earlier, that's a huge team effort when these CFSRs happen. And it's a team effort not just within the department, but it's a team effort for everyone that's involved in our cases, from the legal and judicial partners to the service providers to our foster parents. Anyone who is involved in these cases is really a part of the CFSR and helps to determine our ratings overall. So I really hope that at some point throughout this process, I see most of you involved in some way. Okay. All right.
Any final questions? All right, thank you, April.